If you're over 50 and waiting on a medical diagnosis, you know the quiet anxiety of watching the post every morning for an NHS appointment letter that never seems to arrive. You are not alone in that wait. As of early 2026, roughly 1.6 million people across England are currently stuck in the backlog for a diagnostic test. Looking at this progress ring of NHS performance, the bottleneck becomes clear. The official 6-week target for scans hasn't been met since February 2017. Current performance hovers around 72 to 75%, leaving roughly 1 in 4 patients falling into a 25% failure gap, waiting well over a month and a half. The immediate logistical bypass to this bottleneck is the private sector. By stepping outside the public system, you can cut that timeline down from several months to just 1 to 5 days. But stepping off the waiting list means entering a highly variable, localized healthcare market. To regain control of your timeline without overpaying, you need a clear strategy. Building that strategy starts with understanding the 4 fundamental diagnostic tools available to you. First is the X-ray. It's the most straightforward option, focused on bone fractures and joint problems, with a fixed starting cost of around £99. Next is the ultrasound. It uses high-frequency sound waves instead of radiation to examine organs and soft tissues, with prices starting at £160. Then we have the CT scan. This uses a small dose of radiation and computer processing to create fast cross-sectional images, beginning at £445. Finally, the MRI. This matrix compares cost against technology type. The MRI joins ultrasound in the radiation-free quadrant, starting at £249. Across all options, private clinics deliver results in 1 to 5 days, contrasting sharply with the 4 to 18-week NHS queue. Your doctor will tell you exactly which scan you need. But predicting what you'll actually pay requires understanding how individual clinics price their services. Physical location is your first major cost variable. If you book a clinic in London or the Southeast, you can expect to pay a 10 to 25% premium over other regions. Prices swing wildly depending on the provider. This chart compares a single body part MRI across 5 UK networks. Vista Health offers an entry point of £249, while Circle Health Group peaks at £730 for the same procedure. The clinical complexity of your request directly inflates that base price. Scanning 2 or 3 body parts takes longer, and requiring an injection of contrast dye can add anywhere from £50 to £150 to your total bill. You are also paying for the hardware. Premium pricing often funds access to advanced technology, like AI-assisted image analysis, or higher-field 3 Tesla MRI machines that produce sharper details than standard equipment. That advanced tech has specific, highly targeted applications. For example, under current NICE guidelines, a specialized scan called a multiparametric MRI, or MP-MRI, is now the recommended first-line investigation for anyone with suspected localized prostate cancer. Once you understand these variables, a confusing medical invoice becomes a logical menu. You pay only for the exact level of speed and technology your condition requires. Beyond medical results, going private offers immediate speed, the choice of your own consultant, and the comfort of waiting in a quiet, relaxed environment. We are also seeing the private sector shift from purely reactive diagnostics into proactive health screening, driven heavily by the rising popularity of full-body MRI and CT scans. As this financial scale illustrates, that preventative peace of mind carries a significant footprint. Full-body scans are not routinely available on the NHS, and private costs strictly start at £1,050, often exceeding £2,100. If you do decide to book one, accessibility is straightforward. Most private imaging providers allow you to self-refer, meaning you don't need a GP letter to secure an appointment. Understanding the mechanics of the private diagnostic market removes the fear of the unknown. It allows you to step out of a state of passive anxiety in the NHS backlog and take active control over your own health timeline. As always, this information is intended as a guide. You should always consult your GP or a qualified healthcare professional before making major health decisions.